Unit 15 Neuro questions. 51. A client with spinal cord injury that resulted in paraplegia suddenly complains of severe headache and nausea. The client is diaphoretic with paleoreaction and flushing of the skin. The client's systolic blood pressure is 210 mmHg. The nurse immediately suspects 1. Return of spinal shock, 2. Malignant hypertension, 3. Impending cerebrovascular accident, 4. Autonomic dysreflexia. The correct answer is 4. Autonomic dysreflexia. 52. A client has experienced an episode of myasthenia gravis. The nurse would assess whether the client has precipitating factors such as 1. Too little exercise, 2. Increased intake of fatty food, 3. Vomited doses of medication, 4. Excess medication. The correct answer is 3. Vomited dose of medication. 53. A nurse is performing an assessment of a client suspect of having trigeminal neuralgia. Which of the following assessment questions would elicit data specific to this disorder? 1. Have you had any numbness and tingling on your face? 2. Have you noticed that your eyelid has been dropping? 3. Have you had any facial paralysis? 4. Have you had any sharp pain or twisting in any part of your face? The correct answer is 4. Have you had any sharp pain or any twisting in any part of your face? 54. A client with stroke has right-sided hemiparesia. The nurse would plans to do which of the following help the client adapt to this visual deficit? 1. Place all objects within the left visual field. 2. Place all objects within the right visual field. 3. Ensure that the family brings the client's eyeglasses to hospital. 4. Teach the client to scan the environment. The correct answer is 4. Teach the client to scan the environment. 55. A nurse is teaching a client with myasthenia gravis about prevention of myasthenic and cholinergic crisis. The nurse tells the client that this most effectively done by 1. Doing all chores early in the day while less fatigue. 2. Taking medication on time maintain therapeutic blood vessels. 3. Doing muscle strengthening exercise. 4. Eating large well balanced meal. The correct answer is 2. Taking medication on time maintain therapeutic blood levels. 56. A nurse is performing the oculophilic response test an unconscious client. The nurse turns client's head and note movements of the eye in the same direction as the head. The nurse would most appropriately document these findings as 1. Insufficient, 2. Normal, 3. Abnormal, 4. Inconclusive. The correct answer is 3. Abnormal. 57. A client just had any Foley's catheter removed and is to be started on a bladder retraining program. Which of the following prescribed intervention give the caregivers the most useful information about the client's ability to empty the bladder? 1. Calculating total fluid intake of the SIFT. 2. Measuring post-voiding residual using a bladder scan. 3. Assisting the client to the bathroom every 2 hours. 4. Recording the amount of the client's voidings. The correct answer is 2. Measuring post-voiding residual using a bladder scan. 58. A home healthcare nurse is visiting a client with myasthenia gravis and is discussing method to minimize the risk of aspiration during meals because of decreased muscle strength. Which of the following suggestion would the nurse to avoid the clients? 1. Sit straight up in the chair while eating. 2. Cut food into very small, chewing thoroughly. 3. Swallow when the chin is tipped slightly downward to the chest. 4. Lift the head while swallowing liquids. The correct answer 4. Lift the head while swallowing liquids.